Hey Rob,
Hey, Doug.
so just for everybody's benefit here to introduce you, Dr. Rob Cywes is a bariatric surgeon based in Florida, and I had seen him speak at the conference in Cape Town. And then one of our attendees said, like, you need to get this guy. He was the MVP at the Cape Town conference. And so I reached out again and eventually managed to get hold of you. But what happened was that when you spoke, exactly that same thing happened, was that we got a lot of feedback that, like, wow, this was like the best talk of the whole conference. And so we met up again in San Diego a couple of weeks ago, and I was talking to you and asking about doing some kind of interview with you like this. And just a bit of an anecdote here, that I asked you to put down, because you got so much in your head, I asked you to put down a couple of like topics that we could do, and maybe we do a couple of videos. And I asked you to send me a list, and you sent me a list of 23 topics. So what we've decided to do here is really, seems like it's more all the topics that are going to form a skeleton of your book. And so we're going to go through the whole lot, chapter by chapter, basically, and do a whole series of talks here where you can treat each one as a separate topic almost for the video, and then we'll put it all together for your book later. So yeah, everybody hold on to your hats. This is going to be an awesome ride. The very first chapter is the introduction: opioids, diabetes, obesity, lipophobia, carbophobia, and mental health. I mean, that seems like we could have that's a whole book right there, right?
It is a whole book, and that really is going to form the background to this. But just as an introduction, because my whole treatment philosophy, my understanding of obesity and diabetes, and those words are used interchangeably, by the way. Obesity is diabetes, and diabetes is obesity. They're basically exactly the same disease at the root cause. However, I think in order to treat the two diseases, you really need to understand where they come from and why people are diabetic or obese. If you just lose weight, or if you just treat the diabetes, you may treat or modify or slow down the result or progression of the disease. But until you understand what causes it and address the cause of the problem, you're never ever going to cure the issue or put it into remission. So what I want to do tonight is use a few analogies that everybody kind of understands, and then correlate those and help to introduce a different understanding of obesity and diabetes. So the first concept, and there's going to be a lot of controversial statements made by me, and every single one of them can be supported by life, by evolution, by genetics, and by science. And I don't think anybody else can make that claim. So here goes. The first statement is this: obesity is a mental health disease. Obesity is a mental health disease. It is not a calorie problem, and it is not a nutrition problem. As long as we treat obesity or diabetes from a caloric perspective or from a nutritional perspective, we will fail to treat the cause, and it will occur again and again and again in the same individual. The cause is a mental health disease. And let me explain. In order to explain that, I'm going to tell a story, and I tell lots of stories. So let's assume two people have knee surgery, and the orthopedic surgeon gives them a 3-week prescription for Percocet to help with the knee pain. Now, the interesting thing, this was a fact I learned the other day, was that Advil and Percocet have exactly the same degree of pain receptor amelioration. They get rid of the pain at the knee level in exactly the same amount. But obviously, anybody you ask will tell you that Percocet is a hell of a lot more strong and more powerful than Advil. So how is that possible if at the knee level they have the same effect? Well, the reason for that is because Advil doesn't really cross the blood-brain barrier, but Percocet does. And the opioids have a very, very powerful effect on the midbrain. And in that midbrain, they generate a wonderful euphoric feeling. So not only does the patient experience pain relief at the knee level, they also experience a euphoria that makes the sensation of the pain change. Their perception of the pain changes, and therefore the opioid feels better. So the key aspect here is the midbrain, or the central brain function of the opioids. So the first patient is a pretty cool person. They've got a great career. They're successful in their life. They've got a great family. They've got a well-balanced, fun, pleasurable side to their life as well. And they're just well-balanced people. So they take the Percocet for 5 days. The knee pain gets better. They say, hey, my knee's better. I let go of the Percocet. Off they go. They get on with their lives. The second person finds they take the Percocet, and the Percocet makes their knee pain feel better. But wow, for the first time in their lives, they experience this wonderful euphoria, this wonderful tranquility. That's why they're called tranquilizers. They just relax. Their stress, their anxiety, their depression just lifts away, and they feel this wonderful comfort, this wonderful relaxation that they've never felt before. And they've never even understood that they had this anxiety, stress, and frequent bouts of depression, but it just lifts up. So after 5 days, the pain goes away in their knee, but now they find, wow, this Percocet has secondary value. It has value in my brain. They're not going to acknowledge that. They, oh, my back hurts or my knee hurts. But eventually what they do is they continue to take the medication because they're now medicating a secondary problem that they had. And they find some doctor to write them Percocet prescription, $60 a month. And for years, they live in this wonderful, tranquil state where life is good. Nothing bad is happening. Are they as effective and as successful as they could be? Hell no. They might be in the same job for 20 years instead of rising up the ranks, but they're tranquil, they're at peace, and the opioids are providing for them something that their lives don't provide for them, which is that degree of tranquility and modification of anxiety, stress, and depression. Well, along comes the government and says, oh, we've got an opioid problem here. We've got to get rid of opioids. And what they do is they take the opioids prescribing capacity away from doctors. You get very restricted as physicians. They beat up the drug companies, and suddenly the opioids are gone. I think that that did need to happen. However, the government and the authorities failed to ask one critical question. Why are there millions of people taking opioids chronically like this? Why are so many people addicted to opioids? And if we take them away, what's going to happen? Well, here's what happened. A lot of people committed suicide. A lot of people became alcoholics. A lot of people found other substances that had the same euphoric feeling. And guess what came along? A drug called heroin. And heroin has exactly the same effect as Percocet, except it knocks out your breathing, so you turn blue and die. And now suddenly the government says, oh my God, we got an opioid crisis. Garbage. People have been taking opioids for generations. We've been an opioid society for a long time. But only now it's a crisis because people are dying. And now we understand this massive, massive mental health crisis in our lives and in our society. And where does that mental health crisis come from? It comes from a failure by our society to recognize the value and the necessity of developing relaxation skills in our children and as a developmental part of life. In our society, we are so focused on being ambitious and being successful and on achievement and results. We don't focus on the counterbalance to that hard work and those results and that perfection, which is relaxation. And fewer and fewer kids are given the opportunity to develop and embrace relaxation skills. And we don't have an endorphin management or an emotion management skill set. So we're left with this huge deficit. And we don't have the tools that are required to deal with our anxiety and our stress and our emotions and our depressions and our euphorias. We don't have those tools. So we become addictive as a society. And so what has that got to do with diabetes and obesity? Well, here's what happened. In the 1950s, many, many people were starting to die of heart attacks and strokes. And we had no idea. The one thing we did know at the time is that it wasn't related to smoking, even though 40 to 50% of Americans smoked, because we had no idea that smoking caused heart attacks and strokes in the 50s. So the prudent doctors did a bunch of autopsies on these patients, and they saw, oh, wow, the blood vessels of these patients are clogged with cholesterol and fat, and it looks like there's lard that is just blocking up their blood vessels. So they said, where could the lard be coming from? And they looked at our diet and they saw all the saturated fat in our diet. They saw the lard, they saw the butter, they saw the fat on the steak and on the lamb and on the chicken. And they said, oh my God, this fat that we're eating is clogging up our arteries. That, Doug, was an assumption. There was no, and still to this day, is no factual basis to support the fact that the consumption of fat clogs up our vessels, our arteries. However, it was a hypothesis, it was a theory. And what do scientists do with a theory? What scientists do, they do an experiment. And Ansel Keys and a few other prominent dietitians at the time, or nutritional doctors, performed a societal experiment. They started convincing people to remove fat from our diet. And we created something called the lipid heart hypothesis, where the consumption of lipids or of fats causes heart attacks and strokes. And we as a society started removing fat from our diet. Everything went low fat, no fat. And as a society, we became very lipophobic. We developed a phobia against fat. You look at a piece of bacon, you'll have a heart attack. The problem with that is not only was fat not the culprit, but also food tastes like crap when you take the fat out. So they said, aha, we've got to improve the taste of this food. Well, what can we put in there? Let's put sugar and starch into our food. And we started using gluten fillers, and we started fortifying our food with sugar and starch. We had a fundamental farming culture which grew grains of a variety of different types, and we started fortifying our food with the carbohydrates. And in 1977, we went in the 1950s from less than 5% of our diet being carbohydrates to institutionalizing, to governmentalizing 50 to 60% of our diet as carbohydrates to replace the role of the fat. But here's what people didn't understand. Carbohydrates are not a food. Carbohydrates are a highly, highly neuroactive drug that we've now placed in our food system, and we've told our population that that highly neuroactive drug is healthy for them. So some people eat their cereal or eat their cake or eat their donuts or drink their Starbucks coffee, and they feel that sense of euphoria, but because they've got great balance in their lives, they use it from time to time. Like I might use a beer or a glass of wine to relax and to dissipate some emotion, which is fine. But remember what I said about society. More and more we're focusing on achievement and success and more and more and more. You've got to be better and better and better. Mm-hmm. And those people don't have relaxation methodology. But guess what they find? As 1, 2, 3-year-olds, when you wean them off the breast, they're being introduced to Cheerios and mac and cheese and Capri Sun and all the carbohydrate-rich foods that toddlers are exposed to. And not only are they being told that it's healthy for them, they're also getting this wonderfully neuroactive euphoria that is satisfying, even before they know they're human, satisfying their need for stress management, for emotional management, for anxiety management, for depression management, and they develop this euphoric relationship with a drug called carbohydrates. And they seek it in their diet, and society gives it to them. Society condones it. So at every meal, we're eating carbohydrates, and we're snacking on carbohydrates, and we've become this carbophilic society. So people have become addicted to sugar and starch to replace the deficit of an effective emotional management system. And the problem with our society, not just with obesity or diabetes, but in general, all the mental health we talk about, whether it's gun control, whether it's politicians lashing out and taking out their anger and their anxiety on the population through Twitter, or whether it's fat people, or whether it's an opioid epidemic, all of that comes down to the fact that we as society have a very, very deficient emotional management structure. We just don't have the skills and the tools. And in fact, we disdain those skills and tools. We don't put any emphasis on this. I'll give you some examples. Think about a 4-year-old child that you have who has an interest in, let's say, playing soccer. What do we do as parents? We buy them all the gear, we buy them the ball, we put them on the team, they learn the skills, they go to practice, they play in the matches, and they win. And if they lose, they feel terrible, and they get a trophy if they win, and they go to state championships. And the entire expectation of physical activity of that soccer game is about success and achievement and winning. Hell, the role of sport is not to be successful. Not every kid of ours is going to be Pele. The goal of physical activity is for fun and for relaxation and for play. The right way to treat a child, if he's interested in soccer, is to give him a soccer ball and go outside and kick the ball with them, or tell him to go and play with his friends. That's how I grew up.
Yeah.
I grew up kicking a ball with my friends. I grew up hitting a bat and ball and calling it cricket. By the way, cricket is baseball with skill. Be that as it may, we grew up being given a bat and a ball or a soccer ball or a rugby ball and being told to go outside and play. And then when we went to school, we were put on a team as well. But if you've got that passion, if you've got that wonderful excitement of the fun of sport, you're going to use it as an effective endorphin-releasing skill, as an emotion management tool that you can go for a run or you can go and kick a ball or bounce a ball. But if we turn that into a competitive achievement, success building field, we lose the ability to use it for fun. And what happens when those kids, when they become teenagers? They say, screw this is not fun. I don't enjoy having to win, and I don't enjoy feeling like crap every time I lose. So they stop playing, and these kids drop out in droves from playing sport. The best sports people in the world are the kids that had fun with it on the street and in the parks without it being competitive. Same thing with a painting. When your kid comes home and they've drawn a nice paint, what do you say? Oh, that's beautiful. You're such a great artist. You praise the result. You create an expectation of art. Well, hell, very few kids are going to be Picasso, but we focus on the achievement and the success.
Mm.
The right way to approach a child is to say, man, it looks like you had a lot of fun doing that. Even if the painting looks like the dog threw up on the canvas, it doesn't matter what the result looks like, because we are being creative. We're expressing our creative and artistic talents and artistic expression as part of fun, as part of our endorphin management. But if we weaponize that in terms of achievement and in terms of success and the best we can be, we remove the fun aspect. And then that thing is dead to that child in terms of being a structured part of their emotional management system. So we focus on the deficiency and on the deficit. We don't allow kids to have fun. And then they got to go do their homework, and they got to do this, and they got to do that. And we structure. There's no freedom. So what do those kids find? They find sugar and starch, and they get hooked on it. And the fastest growing demographic right now of obesity in this country is the 2 to 5 year olds. We are creating 2 to 5 year old fat, carbophilic, lipophobic kids.
Wow.
So you see how that correlates with opioids and with diabetes and obesity, because the consequence of that chronic excessive utilization of carbohydrates to manage our emotional needs for their endorphin value, not for the nutritional value, leads to excessive consumption that leads to obesity, that leads to diabetes, hypertension, sleep apnea, ADHD, polycystic ovarian syndrome, all those issues that the kids have. And even more frightening, when those kids are eating a huge amount of carbohydrates under the age of 4 or 5 and not eating saturated fat, their brains are still developing. What happens? Their brains don't develop. What's that disease spectrum called? The autism spectrum.
Autism, yeah. Tell me, in your, sorry to interrupt a second, but
go ahead.
to go back to talking about that very young age demographic, I mean, are you seeing that in your practice? I mean, you're really in obesity medicine, right?
Correct, and I'm a pediatric surgeon, so we see that all the time in our practice. But the interesting thing is this. You don't have to be a doctor to see this. Go to Disney, walk out on the street, and you will see fat kid after fat kid after fat kid. And the issue is not the obesity. The issue is that those children already have a profoundly deficient or dysfunctional emotional management system. And the key thing, Doug, is this, that I'm going to put my glasses on to read this quote. It is a dysfunctional or a deficient emotional management system, a mental health disorder that causes obesity. Addiction doesn't cause emotional dysfunction. It's the emotional dysfunction that lends itself to a vulnerability toward addictive behavior. And that's the introduction to this entire book, to this entire thought process. We've got to get away from treating obesity purely from a nutritional perspective. Now, does nutrition have a role? Absolutely. Because when you remove a drug from somebody, it is critically important that you replace the value that it did have. And almost every other drug, alcohol, crystal meth, crack cocaine, nicotine, all of those are one-to-one. It's a drug that needs to be replaced from an endorphin management system perspective. Carbohydrates are unique in that they actually fulfill two roles. They fulfill a questionable nutritional role. They're not very good for our nutrition, but they keep us alive. And they fulfill an emotion management or an endorphin system role, but they don't do it very well. So when you remove carbohydrates, if you have to replace them with a decent eating plan, which should be a low carbohydrate, high fat eating plan, and you also have to help those people to develop the emotional management skills that they didn't develop as children. So there's duality. The nutritional part is one corner, one piece of the replacement of the role of carbohydrates. But this isn't a diet. It isn't a diet. It's a return away from endorphin eating toward nutritional eating. Two vital systems that we as human beings have crossed over. Think about an alcoholic. An alcoholic is somebody who doesn't drink for thirst. They drink for pleasure. And yeah, it gives them enough fluid to satisfy their thirst, but not very well. And it's not a very effective endorphin system. When an alcoholic quits drinking, they have to separate those two systems out and develop skills in both. They have to drink water and water-like substances, and they have to find something for the emotion management. Exactly the same with carbohydrates. And that is the fundamental that we're going to discuss in this book. So that was my introduction. And I think if you begin to think of this from an emotion management perspective and from a mental health perspective, then you'll grasp what we're talking about.